Shanali, and I will be representing Group 2. Today, I will walk you through this dashboard, which analyzes global trends of confirmed COVID-19 cases and vaccination rates. The goal of this analysis is not only to present key data, but also to offer actionable recommendations for improving pandemic preparedness and responses in our company. Let's begin by looking at the confirmed cases across time. This graph shows the daily difference in confirmed COVID-19 cases globally across time. It highlights the distinct waves of the pandemic, with a significant peak around early 2021 when the highly transmissible variant Delta arose. Later in the year, we see that the trends become more stationary as vaccines started to roll out. However, this stabilization wasn't universal, as many regions still faced localized surges due to variations in vaccine distribution, public health measures, and virus variants, which will be further explained in our analysis. Now, if we take a look at the administered doses across time, we can see the connection between vaccine rollouts and changes in the confirmed cases. This chart tracks the vaccines starting from December 1st, as we observe a sharp upward trend as vaccines became widely available. There's a noticeable spike in early 2021, coinciding with major vaccination campaigns and approvals across the countries. However, the rate of increase begins to slow down mid to late 2021, likely due to the challenges in vaccine hesitancy and supply chain issues. When comparing these two graphs, it's clear that vaccine distribution had a significant impact on the trend of confirmed cases. While the earlier waves were marked by sharp rises and falls, as you can see, the patterns became more stationary after the vaccines have been administered. This shift underscores the vital role that the widespread of vaccination plays in stabilizing case numbers. However, it also reminds that global vaccination efforts must continue, especially in low and middle income countries, to sustain these gains and prevent further waves. Let's now shift to the concentration of confirmed cases by country. This geographic visualization provides a clear picture of how COVID-19 cases were distributed across countries. The darker red areas indicate countries with highest number of cases. Unsurprisingly, large countries like the United States and India stand out. The United States stand out with 42 million cases confirmed, and India with 33 million cases confirmed, respectively. These nations face significant challenges due to their population size, urban density, and healthcare capacities. Now, going one step deeper, we take a look at the confirmed cases by countries across time. This visualization lets us compare how different nations experience and manage the pandemic. For example, if I click on the United States, you can see that their peaks were end of 2020 and early 2021. Whereas if I click in India, you can see their major peak was around May 2021. In fact, for this case in India, the UNICEF reported during this period there was more than 3 cases per second and nearly 3 deaths per minute at this height of the surge. The situation here was devastating for India, with overwhelmed hospitals and slow initial vaccine rollouts in India. This event underscores the importance of studies like this, enabling us as a company to better prepare and ensure adequate vaccine stocks for similar waves in the future. Finally, let's turn to confirmed rates versus vaccination rates. This is perhaps one of the most critical pieces of the analysis. The bars in the left side represents countries with the maximum confirmed case rates, and the bars on the hand side helps us to see the country's vaccination rate. The contrasting lengths of these bars reveal concerning trends. In some countries, you can see that there's a high confirmed case rate paired with a lower vaccination rate. For example, in the country Lebanon, you can see that the confirmed case rate is about approximately 5%. And you can see that the vaccination rate for the same country is less than 20%, which highlights the critical need for targeted interventions in countries like Lebanon, and presents an opportunity for Pfizer to address the likely increase in vaccine demand for these areas. So, what do these insights mean, and what can we recommend based on this analysis? Countries with high demand, high confirmed cases, and low vaccination rates are at significant risk. New variants can emerge in these regions at any point of day, posing the threat not only to their population as a whole, but also to the global public health. Therefore, we recommend the following actions. Proactive inventory management is essential and should be guided by monitoring the high risk areas identified, which may drive increased demand for our vaccines. Enhancing international cooperations with countries and governments in need to ensure vaccine equity and prevent the private virus from spreading across borders is highly recommended. So, to summarize, this dashboard points a comprehensive picture of the global pandemic. It demonstrates the power of data visualizations in identifying trends, disparities, and actionable insights. By addressing these gaps in vaccination coverage and monitoring, we can mitigate the risks posed by future variants and ensure a safer future for all of us in this world. Thank you so much.